यार मेरा हाथ ही नहीं चल रहा है, कुछ पोस्ट।
I'm taking us live on.
या
Shall I admit everyone?
हाँ
Sahana, just make you host. Sahana ma'am, I can't see you. Okay, hello ma'am, Brinda here.
या
Ma'am, I will just make you co-host so you can share your presentation. Parul, Sammy, I'm making one of you the host and the other the co-host.
या
So take over in case my phone just conks.
यस
Okay, thanks. And when we can admit everybody. पारुल, सैमी को co-host बना दो और सहाना मैम को भी।
हाँ, मैं एक बार सिस्टम पे ले लेती हूँ, अभी मैं यहाँ से हूँ। हम लोग लेट हैं आज।
हाँ, मैंने आपको होस्ट बना दिया पारुल। Sorry ma'am, we just got a little delayed. Sahana ma'am, a minute and we'll be ready.
Yeah, sure. Your voice is breaking somehow.
Yeah ma'am, that's why I'm not being the host. I want to make someone else the host. I'm somewhere else and I'm sure it's on my phone. So there's something definitely wrong. That's why. I'm just claiming host Parul. एक मिनट है, मैं उनको co-host बना देती हूँ. I'll do that. Easier.
कहीं रह गया? I have posted in 6 groups. उतने में ही हूँ मैं. I'm going in Telegram now.
Sorry. Again, I'm doing the same mistake. एक मिनट पारुल. No, I'm making you host again, Parul.
वृंदा जी, मैं यहाँ से साइन आउट कर रही हूँ, दोबारा आ रही हूँ तो बनाइएगा।
अयो, मैंने होस्ट बना दिया आपको।
रुक पारुल,
ज्वाइन करती है दूसरी जगह से।
मैंने होस्ट बना, कोई नहीं। Can I reclaim host with?
हाँ, नहीं, we'll be able to do that. I think. Let Parul join again and then we start. You are again host. Wait, Vrinda, 2 more minutes. Parul.
नहीं, Parul has come.
Now she's joining from a system, na? She said.
Yeah. Sahana ma'am is anyway.
She's here. Yeah.
Yeah, I made her the co-host. Sahana ma'am is a co-host.
Yeah.
Parul ko I'll just make host and you admit everybody immediately. Okay?
Yes. The moment Parul comes over. Parul is here.
Yeah, I'm a co-host. Yeah.
Welcome back,
everyone. What is different about it?
So I'm admitting all, Parul.
Can you admit everybody in, guys?
We did that.
You admitted everyone?
Yes, all are in. Parul?
Okay. Then I will.
Would you like to start?
Yes.
Please start. Thank you.
नमस्ते दोस्तों, मैं पारुल। स्वागत है आपका आज के हमारे शनिवार के सेशन में। डाउन सिंड्रोम फेडरेशन ऑफ इंडिया के इन सेशंस में आप लोग आते हैं, बढ़ चढ़कर हिस्सा लेते हैं, हमें बहुत अच्छा लगता है, हमारा उत्साह बढ़ता है। आज हम एक बहुत ही महत्वपूर्ण टॉपिक को लेकर आए हैं जिसे हम मोस्टली नजरअंदाज कर देते हैं, वो है स्किन का। स्किन और दांतों की समस्या को हम लोग खींचते जाते हैं कि हाँ ठीक है, चलिए हो जाएगा। लेकिन दोस्तों ये बहुत महत्वपूर्ण है और इसके लिए आज हमारे साथ हमारी एक बहुत ही खास, बहुत ही अच्छी डॉक्टर डर्मेटोलॉजिस्ट गेस्ट हैं जिनसे मैं आपको मिलवाऊंगी 2 मिनट बाद। उससे पहले एक बात आपसे पूछना चाहती हूँ, क्या आप लोगों ने रायपुर के लिए अपने रजिस्ट्रेशन करा लिए हैं? रायपुर में क्या है आपको नहीं मालूम? रायपुर में हमारी कॉन्फ्रेंस हो रही है। 2-3 साल के बाद हम लोग साथ में मिलने वाले हैं, एक दूसरे के साथ समय बिताने वाले हैं, बहुत कुछ नया सीखने वाले हैं, जिससे हम अपने एडल्ट्स के लिए, अपने यंग जो है टीनेजर्स हैं उन बच्चों के लिए, और जो अभी टूडलर्स हैं या अभी बच्चे छोटे हैं उन सब के लिए कैसे कैसे हमें काम करना है, ये वो अर्ली इंटरवेंशन है या फिर वोकेशनल है या फिर उनकी एजुकेशन के बारे में, उनके स्कूल्स के बारे में, उनके घर के बारे में, वो कैसे लाइफ स्किल्स सीखे, इन सब के बारे में हमारे स्पेशलिस्ट वहां होंगे। उनकी जो अलग अलग सेशंस होंगे वो तो होंगे ही वो, लेकिन वहां उपलब्ध रहेंगे 24 घंटे। आप अलग से टाइम लेके उनसे बात कर सकते हैं, हर तरफ चलते मिलते आप उनसे बात कर सकते हैं, मिल सकते, तो एक दूसरे से जुड़ने का, बहुत सारी चीजें सीखने का ये एक बहुत सुनहरा मौका है दोस्तों। रायपुर में सितंबर में ये होने वाला है, जिसके लिए वृंदा जी बार बार जो है आप सभी ग्रुप्स में वो उससे जुड़ी इंफॉर्मेशन डालती रहती हैं, तो प्लीज आप सब उसके लिए रजिस्टर करिए और हम सब आप सबका स्वागत करने के लिए वहां तैयार हैं। मेरी दोस्त समीक्षा भी वहां मेरे साथ होंगी, और यहाँ मैं समीक्षा को इन्वाइट करती हूँ हमारी आज की गेस्ट से मिलवाने के लिए। समीक्षा।
Yeah. Thank you so much, Parul. Good evening, everyone, and welcome in today's session. And yes, do register for IIDSC Raipur. I have already done that. And I think me and Parul have also booked our tickets. So, coming to today's session, it is a very important aspect of everybody's life. Skin, the most exposed part of our body, needs a lot of care, and I think when we are engaged mentally and emotionally in some other struggles, we tend to ignore it, and it becomes our priority when only we have some kind of infection or some irritation on it. So we have with us today a very popular and renowned dermatologist, Dr. Sahana Srihari. And she has been working in this field from over a decade now. And she has been, with her expertise, she has been treating so many, her patients with so much of diligence and so much of expertise that she is here with us with all her experience. And yes, we will invite her to give a small talk first about how to maintain the cleanliness and hygiene of skin. And she will also address your queries. I will request parents to please listen to her attentively. She might answer most of your queries when she is giving her short talk. And we welcome you, ma'am. Thank you so much for giving the consent and giving your time to us. And the parents are waiting to listen to you, what you have to offer. And we will also take up question answers in the last. So over to you, Dr. Sahana. Welcome, a very warm welcome.
A very good evening to one and all. Thank you so much for the lovely introduction. Today I would, like already told, I would be speaking on hygiene, personal hygiene and skin related issues regarding that. Though I was told to speak on hygiene and skin issues in children with Down syndrome, but I would say my talk today applies to each and everyone. It's for everyone to practice in day-to-day life. Just that with these kids, adults will have to be more active, and we'll have to help them out to carry out all these practices in day-to-day life. I'd also like to say that whatever restrictions or whatever instructions were given to us during the COVID period should have been practiced regularly, not just because of COVID, but it so happened that in the epidemic, there were certain instructions given, like you have to wash every day, you have to wash the vegetables and use, and there were so many things that were that had come into the market as advertisements, and people were practicing because of the fear of COVID. And there were also memes that said that once the epidemic came down, once the second wave came down, people have been relaxed, they are not doing the same things again. But that has to be done on an everyday basis. So I shall start my today's presentation.
Yes.
Hygiene and skin related issues. Skin is the largest organ of the body. The skin, when healthy, protects us from chemical, physical, and biological hazards. Skin is made up of two layers, the epidermis, which is the outer layer, and the dermis, which is the inner layer. In today's talk, I will not be keeping it very medical or scientific. It's a basic concepts. Just here and there, I'll be giving few trivia on the general makeup of the skin. A soft outer covering of the human body. Its functions are varied. It plays a part in sensation because it has a variety of nerve endings which responds to temperature, pressure, and pain. Protection, it's a layer which protects the body from the external pathogens. It is a storage house for water and lipids. It plays a part in thermoregulation. What is thermoregulation? Heat can be lost through dilatation of blood vessels to the skin and secretion of sweat from the sweat glands. Heat is preserved by constriction of blood vessels to keep the warm blood away from the skin. I'd like to say that I think many of you have logged in from various parts of the country. There might be few from Bangalore. I am from Bathinda right now. The climate at Bangalore is 23 and the climate at Bathinda is 43. So to cope up with such adversities, we need skin, without which it would be really tough to tide over such extreme temperatures. Now let us understand what's the difference between cleanliness and hygiene. The term cleanliness should not be used in place of hygiene. Cleaning in many cases is removing dirt, waste, or unwanted things from the surface of objects using detergents and necessary equipment. Hygiene practices, it focuses mainly on the prevention of disease through the use of cleaning as one of the several inputs. For example, a person cleans a floor of a healthcare center using detergent, mop, and broom. They might also use chlorine solution to disinfect the floors. The cleaning process in this example is the removal of the visible dirt, while the use of chlorine solution removes the invisible microorganisms. So hygiene practice encompasses both cleaning for the removal of physically observable matters, like such as dirty hands, you're washing it, and also cleaning yourself from the invisible microorganisms. So the hygiene practice is an example which prevents the spread of disease-causing organisms, whereas cleaning is a means to achieve this task. What is personal hygiene? Personal hygiene is the basic concept of cleaning, grooming, and caring for our bodies. While it's an important part of our daily lives at home, personal hygiene isn't just about combed, shiny hair and brushed teeth. It's important for an overall cleanliness. There are many skin irritants that children may be exposed in day-to-day activities. When something penetrates to the outer layer of the skin, the inner layer of the skin reacts to it. This is when it becomes a pathogen. Strong or regularly repeated irritations of the skin may lead to skin diseases. The skin contains oil glands, hair follicles, and the sweat glands. These are like tiny holes through which you can have entry of various organisms. So the skin can be like a sponge when it contacts with something. It also contains blood vessels, and some chemicals can penetrate the outer layer and enter the bloodstream. The type of environment you're in can cause skin problems directly, or they can work with other factors to increase the skin problems. These factors include heat. Heat causes sweating. Sweating may dissolve chemicals and bring them closer contact with the skin. Heat also increases the blood flow at the skin surface. So this may increase the absorption of surface substances into the body. Cold climate dries the skin. It causes microscopic cracking. This cracking allows substances to cross the outer layer of the skin, thus entering the body. So whether you're in a heated environment or a cold environment, both are hazardous. Medium is always the rule. Coming to sunburns can damage the skin. Sun can increase the absorption of chemicals, and it also reacts with some chemicals to enhance the negative effects on the body. What is health? Health is a state of complete physical, mental, and social well-being, and not merely the absence of any disease or infirmity. Healthy habits that include the mouth clean, skin protected, and washing hands frequently, especially before eating, are certain practices which will be dealt in detail. What's the difference between good and bad hygiene? Good hygiene keeps you protected from things like germs and dangerous UV rays from the sun in the environment that can hurt you. Bad hygiene allows these things to affect your body and can make you sick. What are the benefits of good hygiene? According to Centers for Disease Control and Prevention, addressing the spread of germs in schools is essential to the health of our youth, our schools, and our nation. Good hygiene prevents the spread of such germs. It also helps to give a first good impression to others. You obviously like someone who's well groomed and they are looking pretty. Personal hygiene practices are: one has to take bath daily. You have to brush teeth twice daily. You may all wonder, are these things to be told? It's done on a regular basis. But there are certain parts of the country where they do not consider all these things. I have worked all over the country in many states. So I find that in rural areas, they don't have a practice of taking bath daily. It's either alternate days or once or twice a week. And even with bathing, they don't use the appropriate products that are to be used to cleanse off the dirt. So these are the things that have to be taken care of. One has to wear washed undergarments, uniform, and socks daily. You have to have a personal towel, personal comb. These are things that should not be shared between individuals. Clean and trim the nails regularly. Wash hands after wearing or removing shoes. Wash hands after throwing waste. To listen at, you might all feel that these are basic things, but if you just sit back and think about your entire day, none of these are done on a regular basis. We don't have time for this, but you have to make it a routine so that if you don't do it, you should feel very fidgety. So that's how a routine should be developed for all such things. You should wash hands with soap and water before eating and after using toilet. One has to walk with footwear on always. There are many infections that can be you can be affected with certain infections when you're walking barefoot. So you always have to wear your footwear. Do not play in mud and dirty water. Do not play with pet animals at home. Hand washing. Around 22 million school days are lost each year due to common cold. Some viruses and bacteria can live from 20 minutes up to 2 hours or more on surfaces like cafeteria tables, doorknobs, and desks. Clean hands. There are many students who fall sick once school starts. I think you might all have noticed that over 2 years there was no schooling. It was all online. At least in my experience, kids were hale and healthy at home. There was not one episode of cold or cough or any infections. The moment the schools reopened, one kid is ill, it's contagious. So it spreads from one kid to the other, and it's all over the country. This is the issue. There are many children who've fallen sick once the schools have opened because these hygiene practices are not done in everyone. So everyone has to practice it. Now, although Staphylococcus aureus, which is an organism found as a normal flora, which generally resides in the anterior nares, that's your nostrils, it is rarely airborne. It is almost always transmitted by direct touch, and hand washing reduces its transmission several fold. That's why when in a classroom a kid is affected with common cold, in a series, each and every kid gets affected in the long run. You see, while the primary contact is one of the kids who was not well and has come to school. So many kids in the class get affected. Staphylococcus aureus is spread by the airborne route only 6 to 10% of the time, but 54% of the babies in a newborn nursery handled by a carrier nurse with unwashed hands subsequently becomes colonized with her strain of Staphylococcus aureus. Same holds good for school-going children also. A number of commentators have pointed out that the basic misconception that simple hand washing with plain soap consistently and reliably prevents microbial transmission has been seen. One of the authors discussed the necessity for use of an antiseptic agent whenever hands are heavily contaminated, if a satisfactory reduction in contaminants is to be affected. Here we can note that why am I using this point? Because kids play outside, they come back home, and their hands are heavily infected. It's very muddy. They've played in the gardens, they've played in the playgrounds. Just plain water washing or just a normal soap and 2 to 3 seconds of washing will not be enough. A thorough washing with an antiseptic agent has to be done so that it is not carried further. Another author demonstrated 2 decades ago that washing with plain soap may actually increase the potential for transmission because of a 17-fold increase in dispersal of bacterial colonies from the skin of the hands. Even with the use of antiseptic preparations, reduction in skin microbial density beyond a certain equilibrium level may not be attained. So hand washing is a very important activity that has to be done. How to wash your hands? You should use warm or running water, use a soap or an antiseptic agent. Just scrub hands together and under the nails for at least 15 to 20 seconds. Dry hands on a clean cloth or paper towel or use an automatic hand dryer if possible. So these are the steps for hand washing. It is indeed a long procedure which has to be done every time you wash your hands. First, you have to scrub it palm to palm. Then you have to wash between the fingers, including the finger web spaces. Then the back of the hands has to be scrubbed. Then you have to clean the base of the thumbs and then the back of each finger. The fingernails have to be scrubbed. That's a very important area where microorganisms can get lodged. The wrists have to be washed and then the hands have to be rinsed and wiped dry. Now coming to health of teeth and gums. The health and cleanliness of your mouth is important. If you don't brush and floss, you can get cavities or your breath may probably smell bad. How often and when to brush and floss? At least times a day.
I would request participants to be muted, please. Yeah, ma'am, you can go ahead.
Yeah, at least 2 times a day, 1 time in the morning and 1 time at night is a must. Consider brushing between meals too. I know it is easier said than done. Once any person starts brushing between meals, I think they'll lose the interest in having food. But at least you have to make sure you rinse after each meal. The main agenda behind this is you should not let food particles stay back on your teeth. So this has to be inculcated in kids too. Floss at least 1 time a day. Floss if you feel food stuck in your teeth. What are the foods to avoid? Bacteria in your mouth can grow on sugar. So you have to try to eat as little junk food as possible. It's not only for the health of your teeth, but also for your general body health. Things that are best to be avoided are candies, chocolates, and other sweets. Avoid drinking soda and sweet tea. If you do not eat these things, you may want to brush immediately after. Keeping children away from such foods is the best case. It's there everywhere. Junk food is the norm and it's become an everyday meal for most of them. Fast foods, parents don't have time, so they find these alternatives are time saving criteria. But you have to look at the long run of the health of kids. So try to avoid junk food as much as possible. There are many foods which can be prepared at home, which can be made healthy and can be made tasty as well. You put in little effort into researching about such preparation of such foods, you can definitely avoid junk food. Next is protection from the skin. Childhood sunburns may increase a person's risk of developing melanoma, the most serious skin cancer. More than 1 million cases of non-melanoma skin cancers are diagnosed yearly in the United States, though in India it's comparatively less common. But in Indian skin, a lot of sun-related issues have to be taken care of. The immunological system gets activated on exposure to sun. So there are many photodermatoses that can be very common in children also. Those are the polymorphic light eruptions. Many such allergic conditions can occur. So even in kids, though personally I do not prescribe sunscreens for all kids because I believe that the vitamin D production which happens in the skin when the skin is exposed to sunlight is very important. As it is, the children are not moving out much. They are more indoors. So some exposure to the sun is mandatory. But in few children who have a known allergy to sun, they definitely have to use sunscreens on a regular basis. I think my presentation is 80% of the average person's lifetime sun exposure happens before the age of 18, because that's the time when you get time for activities. After that, it's just studies, work, earning responsibilities. It becomes really tough. So just let your kids play. Do not make sure you use a good amount of sunscreens. Skin cancer is the most common of all cancers, but it accounts for nearly half of all the cancers. So sun protection is a must. How to protect yourself? Avoid the sun between 10 a.m. and 4 p.m. That's the harshest UV rays is during that time. Seek shade, look for shade, especially in the middle of the day when the sun's rays are the strongest. Cover your head with a wide brimmed hat. Shade your face, ears and neck. Kids and sun, all the above set points should be looked after by parents when it's concerned with kids. Kids will never realize when they are in a mood to play. So they do not realize, even in the harshest of summers, you let them out to play for 3-4 hours, they come back, they're still not satisfied, they still want to go out. So all these above points have to be taken care of by parents, not only for themselves, but also for the kids. Wear sunglasses, cover up with protective clothing to guard as much skin as possible when you're out in the sun. You have to choose comfortable clothes made of tightly woven fabrics that you cannot see through when held up to a light. And it's more preferable to wear light colored clothes on a sunny day. Using sunscreens with a sun protection factor is important. A generous amount, about a palmful, all over areas of your skin that are exposed has to be used. Put it on 15 to 20 minutes before going out in the sun. And if in case you have a prolonged exposure to the sun through the entire day or almost most of the day, then at least every 2 to 3 hours, you have to have a reapplication of a coat of sunscreen. There's a biological evidence to support the hypothesis that the use of emollients on skin of healthcare professionals may be protective against cross-infection. Moisturizers prevent dehydration. They prevent the damage to barrier properties, desquamation and loss of skin lipids, and they restore the water-holding capacity of the keratin layer. This increases the width of corneocytes. There's growing interest in the use of barrier creams and lotions that not only shield damaged skin but also restore its structure or function. In a Swedish single-blind study, a moisturizing cream was found to accelerate the rate of recovery of surfactant-damaged skin. I know it's a very tedious job to apply creams on a regular basis, but if you do it on a regular basis, you can avoid a lot of problems that can occur, and that will also save you a lot of hospital time. So a daily use of moisturizers is very important. Like I already mentioned, it's not about the climate. Even in summers, even in humid summers, the skin can get dehydrated. So you have to use moisturizers throughout the day. Fingernail and toenail hygiene, that's the nail care. A nail is a hard tissue that constantly grows. The long fingernails tend to accumulate or trap dirt on the underside. And it's very common for this to occur in children. So you have to always make sure you keep checking the nails of your child and keep cleaning it and keep it clean throughout. The dirt could be a result of defecation or touching infected and contaminated surfaces. It could be mud during play. Keeping nails trimmed and in good shape weekly is important in maintaining good health. The nail should be clipped short along their shape, but do not cut them so close that it damages the skin. Even if you overcut the nails, there can be a lot of problems that can occur. So it should always be on the safer side. Razor blades and fingernail cutters or scissors are used to cut the nails. The nail cutter should not be shared with others. You should have a personal nail cutter also. Coming to ear hygiene, ear wax accumulates in the ear canal that leads from the outer ear to the eardrum. As this secretion comes out of the ear, it collects dust particles from the air. Now, regarding the ear, daily washing with soap and water is enough to keep the outer ear clean. There are a lot of myths that you have to keep cleaning the ear. So a lot of people use towels, earbuds to clean the ear and take out the wax, but do not do that. It actually harms the ear more than doing good. Do not reach farther than you can with your little finger into the ear. Putting in hairpins, safety pins, blood nets, things for cleaning purposes might harm the ear. There have been cases where there has been caused deafness because of such practices. So you have to avoid all such things. If you feel wax has accumulated and is plugging your ears, interfere with hearing, always consult your ENT specialist. Hair hygiene. The hair follicles from which the hair grows produces oil from the sebaceous glands. This keeps the hair smooth. That's why we always avoid, as dermatologists, we always advise again daily hair wash or scalp wash, because this washes out the protective oil layer that is there on the scalp, causing further dryness. The scalp, that is the skin covering the head, also has numerous sweat glands and is a surface for the accumulating dead skin cells. The oil, the sweat, and the dead cells all together can make the hair greasy and look dirty unless you wash it regularly. Poor hair hygiene could cause dandruff and skin infections such as tinea capitis or the fungal infection on the scalp. After my last talk, I had many parents who had contacted me with fungal infections in their children and how to handle it. So these regular practices of proper hair hygiene and skin hygiene can actually avoid such infections. Dandruff is the dead skin on the scalp that comes off in tiny flakes when sebaceous glands produce too much oil, and this accumulates on the scalp. So a regular washing is necessary. Over regular washing is avoided. Hair is a good harbor for head lice, that is the pediculosis humanus capitis, and the nits, that's the eggs of the head lice. Head louse is a tiny insect. It lives by sucking blood. Children are especially prone to lice infestation, and if one child is infested, then obviously all the children coming in contact or having close contact during school hours can get infected also. So lice spreads from one head to another when there is close contact. As in school, they make the scalp itchy and are a cause of annoyance, irritation, and embarrassment. Shaving of the head hair is possible in cases of heavy lice infestation. You would always want to avoid all this. I think there's someone writing on the screen.
Parents will request.
मुझे लगता है कोई बच्चा यूज कर रहा है, प्लीज ऐसा ना करें.
Yeah, keep off the touchpad, please. Do not.
Sharing of blades with others, however, should be discouraged, because even I have seen a lot of cases where the patients have gone to salons for a haircut or shaving, and they've come back with fungal infections and viral infections like warts and all that, because they do not sterilize the blades properly. So you should never share your blades with others. The recommended procedures for cleaning hair are: use clean water to wash your hair regularly. Regular is at least twice weekly, preferably once every other day with shampoo. Massage your scalp well. This will remove the dead skin cells, excess oil and dirt. Rinse well with clear water. Always cold or lukewarm water is more preferable than hot water, because it doesn't open up the cuticles and your hair doesn't get rough. Conditioner is helpful if you have longer hair, as it makes the hair smoother and easier to comb, but hair doesn't need to have a conditioner. Use a white tooth comb for wet hair, as it's easier to pull through. Dry the hair and head with a clean towel. Never share a towel with someone else, and comb the hair to look beautiful. Now coming to foot hygiene, we spend a lot of time on our feet. Our feet sweat as we walk day and night, and the sweat accumulates on all the surfaces of the foot and in between the toes mainly. The sweat may stain the shoes and can produce an awful odor. All of you must have experienced at least once or twice in your life having people moving around with awful odors. That's really bad. As well as bacteria, sweat also encourages fungal growth between the toes. This is called athlete's foot. The symptoms of athlete's foot are many. It's some irritating condition, and it disappears by itself. Sometimes these cracks and sores may become site for other infections, super added bacterial infections. So the feet should be washed daily or at least twice weekly. Daily. The foot hygiene is important in treatment of podoconiosis, sometimes known as mossy foot, which causes swelling in the feet and lower legs. And toenails do not have much role in transmission of diseases, provided it is trimmed and kept clean. However, they may also accumulate dirt. This can increase the potential for bacterial and fungal breeding. Now, coming to armpit and bottom hygiene, these are body parts that easily get sweaty, and when ventilation is poor, there can be a lot of conditions that can occur. After puberty, our sweat gains a specific and unpleasant odor, which may be offensive to others. So you always have to keep yourself clean. They should be washed daily. Anal cleansing is the hygienic practice of cleaning the anus after defecation, and your hands should be washed with soap afterwards. Now, coming to clothes, we usually have two layers of clothing: the inner layer, which is the underclothes, and the outer layer. The inner layers are the ones which are right next to our skin. They collect sweat and dead skin cells. This can also stain the cloth. The bacteria love to grow on this dirt, and they produce a bad smell in addition to the odor. Underwear must be washed more frequently than the outer clothing. It's an important aspect of one's dignity. Changing clothes every day for clean ones is a must. Washing dirty clothes requires adequate clean water. Detergents have to be used, and the clothes have to be washed, and you always have to wear clean, dry clothes. Again, drying the washed clothes is very important. If there's any amount of moisture on a long basis, then that can also cause fungal infections. If possible, the clothes that are washed should be ironed to help destruction of body lice and nits or any fungal elements. Hot water can be used to wash the clothes. Frequent changing into clean clothes is always a necessary. Now, there are certain conditions that can occur because of not maintaining healthy habits or hygienic practices. These are pityriasis alba, which is a condition because of dry skin not using moisturizers. Pediculosis capitis is your head lice. Pyoderma is the bacterial infections. Seborrheic dermatitis is the condition wherein there's accumulation of sebum if you're not cleansing yourself on a daily basis. Tinea corporis is the fungal infection. Scabies is again an infestation which occurs because of poor maintenance of personal hygiene. Molluscum contagiosum is a viral infection, which is that and warts. Both are viral infections. Like I mentioned in foot care, this is what happens when an infected person is using some public place, for example, swimming pool. They walked over a certain surface, and there's another person, healthy person, who's walking over the same surface on a barefoot. They can contract the infection. So you have to be careful. Eczema is again because of lack of personal hygiene, but it is also an autoimmune condition where the immunity plays a role. But using frequent moisturizers can reduce the extent of the disease. Malaria occurs because of heat, and athlete's foot is again the fungal infection in the feet. Body lice. Chronic diarrhea is a systemic infection because of poor hygiene. Dental caries was discussed. Head lice. Hot tub rash is a condition wherein you're using a public tub where some other people have used it and it's not cleansed properly. It occurs because of Pseudomonas aeruginosa. It can present as dermatitis or folliculitis. That's inflammation of the skin or the hair follicles. Filariasis, pinworms are all can occur because of echoral root. Swimmer's ear can occur. Trachoma is one of the conditions. So these are a few conditions which can occur because of lack of personal hygiene. The government of India has launched the Swachh Bharat Abhiyan initiative in 2014. There was emphasis on promoting safe and hygienic practices among school children. This provided easy access to hygiene and health education regarding personal hygiene. which is a simple and cost-effective tool for prevention and control of hygiene-related health problems, which also includes skin diseases. To conclude, I would say personal hygiene is a necessity for our daily activities. It's very important for the protection of our health and helps to prevent the spread of communicable diseases. It has social and aesthetic values. An individual who follows the practice of proper personal hygiene always gains confidence, pride, and dignity. It applies to all parts of the body, but hand hygiene is probably the most for public health. The procedures that apply in the personal hygiene need to be followed strictly to gain the best results. The promotion of personal hygiene should aim to change the human behavior. The provision of hygiene information first impacts on knowledge and then practice. The promotion of personal hygiene must be well planned in order to bring positive changes. Thank you.
बहुत शुक्रिया डॉक्टर, आपने इतनी अच्छी जानकारी दी। और मैं मतलब एक कहते हैं कि बोरिंग लगता है कभी कोई मेडिकल इंफॉर्मेशन देता है, लेकिन इतना इंफॉर्मेटिव था और इतना इंटरेस्टिंग था सब कुछ के बहुत ध्यान लगा के हम सब सुन रहे थे। समीक्षा, अब क्या हम सवाल जवाब ले लें? एक क्वेश्चन आया भी हुआ है चैट बॉक्स।
Yes, you can take questions
in 2 seconds.
जी।
Yes, it was a very informative session, and she rightly mentioned that whatever behavior for hygiene we embraced in COVID era, we should continue with that, and that should be a regular way of keeping the skin and the journal cleanliness, hygiene. But the busy life, Parul, and the occupied mind and things to do in hand, there are so many. So many places our mind is occupied that it gets difficult to follow those enlisted journal routine hygiene things also, which doctor has shown us
actually.
Yeah, so we are open to take the question answers. Parents, you can raise hand and ask, and you can also put it in chat box. Doctor, we had received one question from a parent. She was telling that the bottom of the child is mostly dry, and there are some small structures. If you agree, I can share the picture. The parent has shared the picture of the bottom of the child, and it has got little small bumps. I'll just try to share my screen. And Varsha, we are coming to you. You have raised your hand. So please tell me if you can see my screen and if I'm able to share it. Can you see my screen?
Yes.
Yeah. So this is the picture shown by the parent. And she says that it is mostly like this. So if you can help the parent knowing what it is and how it can help. You want me to show it for a little longer?
No, there are certain papules and the skin is a bit rough. I think such conditions do occur when there's some vitamin deficiencies. So the nutrition of the child has to be improved on. I think raw carrots can be given. As for the infected parts, they can contact me later personally. I would definitely help them out with what creams can be used. And for treatment as well as later for maintenance. I think moisturizing that area is also
important. Okay. So maybe the parent must have got the answer, and we would definitely like to know the more. So how can the parent contact you once again? And we have Varsha raising hand. Varsha, can you unmute yourself and ask the question, please?
Yeah. Hi, doctor. Actually, I wanted to ask a question for my daughter. She has these black, I wish you can see, the fingertips are black slightly, as though it's tanned. All her fingertips are like that. I don't understand. I mean, I'm applying moisturizer and many things, but is this fine? I mean, are you able to see?
Yes, I can see.
Yeah, so I am applying, twice, thrice moisturizer on her hand, but this seems to be dry, and she is always, picking her dead skin.
Okay. There are certain areas in the body which have a differentiation in the coloration. Like suppose in general the armpits and the genitals areas are a little more darkly colored. So, but if this discoloration has occurred recently or acutely, there can be quite a few reasons. One is when the child is constantly plucking on the skin, we call it as frictional melanosis. Because of friction, skin always reacts by darkening. That is one of the causes. Another thing that you'll have to take care is the vitamin B12 levels. If the diet is not completely adequate and the B12 levels are low, that can also cause such pigmentation. You can definitely get a B12 levels checked, and if it's whatever the results are, you can contact me. I'll let you know what has to be done.
Okay. And one more thing, doctor. Is this visible? Is this visible?
Yes.
So she has such marks, you know. कहीं कुछ चोट लग जाता है, she's always itching it, and this is the end result. And this doesn't go.
She must have had red lesions before these marks, right?
She must have had, I didn't get you.
Red lesions?
Irritation, yeah.
No, red. She must have had some red pimple type of lesions before.
No, some mosquito bite, or you know, somewhere she must have fallen and she must have got some hurt.
Yeah,
So
these have formed scars now.
Yeah, so this is not going to
on that skin. And maybe because around that time you've not used adequate moisturizers, which has caused her skin to become itchy. So she's scratched, and that's become. It will take quite some time to go. Because we have a saying in dermatology: once a scar, always a scar. So it's very tough to go. Prevention is always better.
than cure.
But anyways, I can tell you creams that you can use in particular for those scar marks. Plus regular use of moisturizers that will do half the job.
Okay, and what about the stretch marks, doctor? Why are they, visible now? For her?
For which area of the body?
The waist area.
Waist area. Did she have any recent changes in weight? Weight gain or weight loss?
Yeah, weight loss.
Weight loss, yeah. See, because when you're a little more healthy, the skin stretches. So when you have weight loss, that stretched skin is coming back. So that is what stretch marks is all about.
So even this is like, this will be there?
It can be reduced. It will not go completely, but it can be reduced to a certain extent. Again, moisturizers play a very important role in that.
Okay.
But it will not come back to the 100% normal skin.
Okay.
Nowadays, a lot of cosmetic procedures which have come up. But I would say that they are quite expensive procedures. But yes, the results are quite satisfactory. But in your case, I think moisturizers would play a better role in treating the present stretch marks. Another thing is in preventing further marks.
Okay. So twice a day.
Moisturizer should be really good.
Okay. Thank you so much, doctor.
Yeah. So next we have Rashmi ma'am raising hand. Rashmi, can you unmute yourself and ask question? Good evening.
Good evening. Good evening. Thank you, doctor, for such an informative information. I want to ask one thing. My daughter, she has a lot of boils on her thigh area. I think it's due to sweating. She sweats a lot. So is there any solution? What can I use so that she doesn't have those boils? And it's painful sometimes.
May I ask where you're calling from? Which part of?
I'm Delhi, New Delhi.
New Delhi. Right. See, like you said, if these, I would obviously like to see the lesions before commenting on anything. Is there a possibility that I can get to see the lesions?
Right now, she's not at home, but I'll connect with you. I'll try to send the picture.
Right. Once I see that, I'll be able to tell you more in specific. But in general, in any hot and humid areas, there are certain things that you have to follow. I mean, avoid tight-fitting clothes. Try to wear cotton clothes, loosely fitting ones. And once in a while, if the child is sweating a lot, you'll have to clean them, sponge bath them. Just take a cloth, dip it in water, wring out the excess water, and then sponge bath them. That will give a lot of relief. that has to be done on a regular basis. If it's
Cold
just
water. Cold water.
any water.
Preferred. अच्छा, okay. She wants it cold. Okay, okay.
Any water, and mainly aeration has to be followed. I mean, you have to let certain parts of the body under the direct air. I think kids will never realize this. They just don't get to know anything. So
And then she starts scratching actually.
Sorry?
Because of, then she starts scratching because of the irritation, and then it further creates problems.
All these preventive measures we as parents have to follow, have to keep a timetable, a routine, and then observe and then help them out with all that.
Okay, okay. Thank
And
you.
definitely show me the lesions once I see that, because you're saying reddish lesions, that can be a number of causes. So each one has a different management. So once I see the lesions, I'll be able to help you better.
Okay, okay. I'll send you the picture.
Yeah. So thank you, Rashmi. I would request Seema. Seema, you have raised hand. Seema, can you unmute yourself and ask, please?
हेलो
Yes, Seema, we can hear you.
हाँ जी डॉक्टर मुझे पूछना है मेरी बेटी के हेड में जो है वो ना ऐसे राउंड राउंड पैचेस हो गए हैं तो 3 जगह पर हुए हैं तो उसको मैं डर्माटोलॉजिस्ट के पास लेकर गई थी जनवरी से उसका जैसे शैम्पू उन्होंने चेंज किया था और एक स्प्रे है वो लगाया था क्रीम लगाया था मैं कंटिन्यूअसली लगा रही हूँ अभी तक लेकिन अभी तक मुझे कोई अच्छा रिजल्ट नहीं आया उसका तो कोई कुछ और है जैसे कि जिससे मैं उसका थोड़ा कर पाऊँ ठीक
कहाँ पे हुआ है पैचेस
एक तो हेड के बिल्कुल ऊपर में हुआ है मैं वीडियो में ट्राई करती हूँ मेरे क्योंकि नेट थोड़ा स्टेबल नहीं है
इट इज ऑन द हेड एरिया सीमा बेसिकली सर पे है
हाँ 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 सर में है वो राउंड आई विल ट्राई अगर वो नजर आता है तो कावेरी वेट नजर आया क्या
या सहाना मैम कैन यू सी
one second, I need to pin this.
Oh, alopecia.
Can you just
अभी जैसे वो
सीमा आप इसका पिक्चर लेके भेज दीजिए ना अभी पिक्चर लेके भेज दीजिए समीक्षा को या मुझे
ठीक है
फैमिली को भेज दीजिए ठीक है वो शेयर कर देंगे
ठीक है
पिक्चर लेके भेज दीजिए
हाँ तो इसके अलावा कुछ ऐसा है कि जैसे मैं घर पर ही कुछ और यूज करके इसमें थोड़ा इम्प्रूवमेंट ला सकती हूँ
होम रेमेडीज का बात कर रहा हूँ
हाँ कि ऑयलिंग वगैरह तो मैं कर रही हूँ वीक में जो सा है वो पहले अभी थोड़ा ठंड थी जब तो 2 बार करती थी अभी गर्मी की वजह से जो है वो सिर्फ वीक में 1 ही बार इसका ऑयल लगाती हूँ हेड के ऊपर 1 दिन पहले जब हेड वॉश करना होता है तो
पहले मैं एक बार कंडीशंस देख लेती हूँ और प्लीज मुझे पहले का ट्रीटमेंट जो लिया था उसका भी डिटेल्स चाहिए होगा
उसका हाँ उसका वो मेडिसिन वगैरह वो ओके उसका भी मैं पिक्चर भेज दूंगी
Okay, Seema, then we will connect to you, Sahana ma'am, later. Okay.
Okay. Thank you, doctor. Thank you.
Ma'am, before I ask another parent who has raised hand, there are 2-3 in chat box I would like to read. A parent says that, hello doctor, when my daughter Anya eat anything made of basin, she gets rashes on her face. After a face wash and moisturizing, it disappears. So is it...
Okay, medically this cannot be explained, but there are some situations where a particular food item may be allergic. So if you have observed that specific thing happening, then I would recommend it's better to avoid basin for your daughter. That's a basic thing. But if it's any food allergy, it's usually generalized with some abdominal symptoms. If she's not having any stomach pain, or the rashes every time appear only on the face, then you'll have to reconsider what you're thinking of as allergy. So maybe you can, the next time she gets rashes, you can just click a picture and then contact me. I can let you know if it's because of basin or it's anything else. And how you can it.
Yeah, hope you have got the answer. Now I would like to ask Shri, mother of Amrit, to unmute and ask question, please.
Yeah, hi, ma'am. Actually, my son Amit, he has some white spots on his hand. It's only on his hands.
Okay.
Small this thing. Okay.
Can you show us hand once? It's very blurred. Would it be possible to send pictures?
Sure, ma'am. Amit, it's actually she. Wait.
So anytime when the child is asleep, if you can click pictures and send, that would be better.
Sure, ma'am. Okay. Like the small spot kind of thing, only on his hands. And 3 days back, he had rashes all over his body. So I took him to a dermatologist, and she told it might be a carrier. And she said there will be multiple reasons for it. And she's given the calamine lotion and Atarax and Allegra for reducing the things. So I'm using it right now for him. So is there anything that I have to check?
No, I think that treatment is perfect. If it was rashes all over the body and urticaria, you can just continue with that. But in urticaria, it so happens that if you immediately stop the treatment, it might rebound. So just follow up with your dermatologist, and you'll have to slowly taper the medications and stuff.
Okay, so I have to keep following it up, is it, ma'am? Or
yeah, you cannot stop it abruptly. Like the treatment is given for 2 weeks, you stop it right after 2 weeks, it might rebound. So just consult with your doctor for whatever time period, and they will guide you as to when and how the treatment should be stopped. And in the meanwhile, you'll have to keep a note on what the child is allergic to. If during the medications also they are developing lesions, you'll just have to note down what the child has eaten on that day, and keep a chart for that, so that you'll get to know what the trigger is.
okay, he's been playing too much with the mud and all these things, so
Usually can cause urticaria. That's not a very common. The most common cause is something edible, some food item. So just note down the diet chart and have a chart that you can mention whatever the child has taken when the child developed lesions, so that you'll get to know at the end of 2 weeks as to what happened.
Okay, ma'am. Okay. Okay.
I think in the chat box, someone has messaged how to treat tinea capitis, any home remedy. Please, I would request you, there's no home remedy for anything basically, not only tinea capitis. There's no home remedy for any pathological condition. Maybe prevention, you can do a lot of things. I would suggest you to kindly get in touch with the dermatologist and get the thing treated completely, rather than trying for any home remedies, lest it becomes really extensive when the treatment would be tough. It would be tough for you as well as the doctor.
Yeah. So we have one parent raising hand. The name is coming Android Blue Droid. Please unmute yourself and ask.
Good evening, ma'am.
Good evening.
My daughter Ananya.
Yes, please go ahead.
मैम जब भी वो किसी चीज के लिए जोर लगाती है ना, जैसे वॉमिटिंग हो रही है कुछ, तो ऐसे पैचेस उसके मुंह पे बन जाते हैं. अब जैसे वैक्सीनेशन कराई है, सेकेंड डोज है, उस दिन थोड़ा फीवर आया है कल, तो उसके बाद उसको वॉमिटिंग सेंसेशन हुई है, तो जैसे ये आईज भी रेड हो रही है ना. और आज तो थोड़े कम है, नहीं तो रेडनेस आ जाती है जब भी ये रोती है या जोर लगाती है ना, सिर्फ फेस पे.
It is not because of वो जोर लगाने की वजह से नहीं है. फेस देख के लग रहा है काफी अमाउंट ऑफ ड्राइनेस है, एंड हर स्किन इज वेरी सेंसिटिव. You'll have to let me know what you're using on a daily basis. Maybe you'll have to change your products so that you can regularly use a proper face wash and moisturizers. Her skin is pretty dry, so if you use a good amount of products, and even the lips are quite dry. I hope she's having enough amount of water.
वो हाँ जी, वो फीवर हो गया ना, वो कोवैक्सीन की सेकंड डोज लगी उसके बाद, तो थोड़ा वो सिर्फ वही पी रही, ORS ही पी रही है अभी ना, उस वजह से थोड़ा
if you change your face wash and moisturizers, that should work.
Okay, thank you so much.
It has nothing to do with her vomiting or anything.
Okay ji, okay, thank you so much ji.
So we have Mithun Saha raising hand. Can you unmute yourself and ask question, please?
गुड इवनिंग मैम, मेरा बेटा 1.5 years का है, तो मैंने जब भी उसको ऑयल लगाता हूँ सर पे, तब उसका वो सिर के ऊपर टॉप ऑफ द हेड उसका कुछ फंगल इन्फेक्शन जैसा कुछ हो जाता है। तो मैंने डॉक्टर को दिखाया था, तो उन्होंने कुछ जो हेयर ऑयल है उनको मना किया था यूज करने के लिए, तो वो जब मैं इस्तेमाल नहीं करता हूँ तब ठीक रहता है, बट कंटिन्यू उसको स्टॉप रखना तो मुश्किल होता है, तब जब भी देता हूँ तभी भी हो जाता है। तो मैम आपकी तरफ से कुछ एडवाइस रहेगा तो अच्छा रहेगा।
फिर से मुझे देखना पड़ेगा क्या लीजन्स हो रहा है। मोस्टली इट वुड नॉट बी फंगल, क्योंकि ऑयल लगाने से फंगल इन्फेक्शंस नहीं होते। बट आई अंडरस्टैंड आपको ऑयल छोड़ देना भी मुश्किल लगेगा। यू हैव टू ऑयल एटलीस्ट वंस इन अ व्हाइल। सो आप वो जो भी लीजन्स है उसका पिक्चर बना के मुझे भेज सकते हो। मे बी आई कैन ऐड अ शैम्पू, जिससे ना वो सीबम कंटेंट भी थोड़ा कंट्रोल्ड रहेगा, ताकि उसको वो लीजन्स ना आए।
मैम जॉनसन का जो बेबी शैम्पू रहता है हम उसको लगाते हैं, बट उसमें इफेक्टिव नहीं हुआ मैं उसके।
सॉरी, कौन सा लगा रहे हैं?
जॉनसन का और हिमालय का दोनों मैंने इस्तेमाल किया ऑल्टरनेटिवली।
अगर मैं वो जो भी पैचेस आप बोल रहे हो ना, अगर मैं वो देख सकती हूँ तो मैं आपको सजेस्ट कर सकती हूँ कि कौन सा शैम्पू यूज करना है। जॉनसन शायद बहुत माइल्ड होगा, इट विल नॉट बी टेकिंग केयर ऑफ द इशू।
Okay.
Doctor, we would request you put in an information that how they can send you the pictures in chat box, because I think there are most of the cases you need to see it and then give them the advice.
I think I can share my number. They can contact me through WhatsApp on this number.
On WhatsApp?
Yeah.
So parents, you can note down the number and click the picture, write a detailed information about your child and send to the doctor and wait for the reply, so that she can calmly reply to all of you, and it is not a clutter at her end, because she'll be only person answering so many, right? So Mithunji, will you be able to do that? Mithun sir?
मुझे लगता है इस टाइम वो नहीं सुन पा रहे हैं, नेट में कोई प्रॉब्लम होगा समीक्षा।
I would like to show another picture Parul just shared with me. Another parent wanted to ask this. Then I'm going to Bhavna. Bhavna, I'm not able to access the pictures you have put on a chat box for me. So I would request if you share it in some other way. Ma'am, just let me know if you can see my screen. I'm sharing it now. So this picture has been shared by a parent, and she is wanting to ask, can you see that picture, ma'am? She is asking, मेरे बेटे को फुट में ऐसे स्पॉट्स हो जाते हैं, इनका क्या कारण हो सकता है?
These look like calluses, callosities. I think the skin might be dark might be thick in that area.
Are you there, Barnali? अगर आप उधर हैं तो if you can just unmute and ask.
Yes ma'am, yes ma'am, वो डार्क हो जाता है and बहुत ड्राई है।
Dry है. Is it thick in that area?
Yes.
Okay. These are called as callosities. पहले तो you'll have to check if your child is walking barefoot on pointed surfaces, stones पे या कुछ ऐसे. You'll have to check with the kind of footwear they are using. If there are any pressure points on that footwear because of the design or something where that particular point is having some pressure, then that can cause such lesions. There are creams to resolve this, and once the skin, once whatever this issue is resolved, you'll have to again use moisturizers, and a proper soft-soled footwear would be better.
That I'm taking care of, ma'am, about the shoes. And as far as moisturizing the area is concerned, I keep on oiling his feet regularly.
right? In callosities, what happens? It's a conical lesion. If your foot is like this, the callosity is like this. So even on the top, if you're treating with moisturizers, if the cone part is there beneath, it can keep recurring. So maybe you'll have to visit a dermatologist and get that removed. It's a minor procedure. It's a OPD procedure, but they'll just be scooping out the entire lesion and removing it. Maybe a week or 10 days it might take to heal, but once that's done, such recurrences can be.
Okay, yes, it is reoccurring. Yes. Thank you for your information, ma'am.
Yeah. If you parents also want to share the picture and ask you question, but I can't see Bhavna here now. She was asking me to show some pictures. I'm not able to access. Doctor, can you are you able to access the chat box? There are 2 pictures the parent has put. I am not able to just open them.
My chat box doesn't show any pictures.
Okay, ma'am. So we'll go to Rachna. Rachna, will you unmute yourself and ask?
मुझे भी कोई पिक्चर दिखाई नहीं दे रही।
Okay.
Hi, good evening, ma'am.
Good evening.
Ma'am, I just want to ask, ma'am, मेरी बेटी के ना inner thighs में दाने से हो जाते हैं मोटे मोटे। I don't know क्यों। थोड़े दिन में जैसे होते हैं, फिर वो अपने आप ठीक हो जाते हैं, फिर हफ्ते बाद फिर से हो जाते हैं। और इतने मोटे होते हैं कि मतलब उसके लिए इनरवेयर पहनना भी बहुत मुश्किल हो जाता है।
Okay, एज क्या है?
She is 14.
14. Has she been using any methods for hair removal or something?
No, ma'am, not of any kind.
That is not done. Okay.
No. और ये मैम प्रॉब्लम ऑलमोस्ट उसको 1 ईयर से हो ही रही है। एक बार मैंने स्किन स्पेशलिस्ट को दिखाया भी था, उन्होंने कुछ दी थी लगाने के लिए, पर उससे वही मतलब टेम्परेरी, लेकिन वो बार बार होता है। आई डोंट नो क्यों।
इसको पायोडर्मा बोलते हैं। कभी कभार क्या होता है, लाइक आई वाज टेलिंग, स्टैफिलोकोकस ऑरियस यूजुअली इज इन योर nostrils, umbilicus, fingertips and perianal area. When you touch these areas and without cleansing your hands, you touch other parts of the body, sometimes with small cuts or something, it can become pathogenic. If such lesions are recurrent, it's occurring many times, then you'll have to use a cream for a period of 1 or 2 months in all these areas.
Okay.
After antibiotic, then your recurrences will stop, and zinc supplementation should be given. You can just Google on for foods that are rich in zinc, or you can just put the child on zinc supplement for 20 days or so, which might help.
Okay, zinc supplement and which cream, ma'am?
Cream is a topical antibiotic. I will not be allowed to tell any trade names in talks like these. So pardon me. Maybe like I've shared my number. Once you can get in contact with me, I can let you know what you can use.
Okay, right, ma'am. And then the dryness of the skin. मतलब though I apply a lot of like oil and all, but still उसकी ना skin बहुत dry रहती है.
Oil most of the times doesn't take care of it. For my patients too, I recommend oil, mainly coconut oil, only when they are not able to afford expensive moisturizers, because moisturizers are any day better than the normal oils. Even in such patients, I do tell them once or twice moisturizer application, and rest of the times I can use oils. So paraffin-based moisturizers are much better than your daily oils. So I think you should start using moisturizers.
Okay. And one more thing. She has a dandruff in her hair, and that too in patches. ऐसा लगता है जमा हुआ है, जम जाता है उसका, और फिर वो मैं उसको जैसे एंटी डैंड्रफ या कुछ लगाओ तो थोड़ा सा होता है, और अगर हम ऑयल लगाते हैं, ऑयलिंग करते हैं तो भी बहुत जम जाता है। अगर हम ऑयल नहीं लगाते हैं तो उसके बाल ऐसे लगते हैं जैसे पता नहीं कितने रूखे हैं।
These scaly patches can be 3 things: either seborrheic capitis or tinea capitis, which is a fungal infection, or psoriasis. And these things are entirely different. The treatment is also entirely different. So I request you to kindly share pictures. Once I have a look at it, I can guide you better.
Okay, right, ma'am. I'll do it. Thank you so much.
Samiksha ji, you're muted.
कोई और हमारे दोस्तों के सवाल हैं तो आप पूछ सकते हैं, अदरवाइज तो डॉक्टर का नंबर हमने शेयर कर ही दिया है, तो आप उनसे मैसेज करके और वेट करके जब तक वो जवाब ना दें, और प्लीज कॉल तो बिल्कुल ना करें।
Yeah. Patak sir also had raised hands. It is sir or ma'am, I can't make out because the video is off. So if that participant who's entered as the name of Patak, you want to ask something? I had seen a hand raised of yours.
Yes, my actually I'm Barnali here. My
Hi
name is.
Barnali. हाँ बोलो बोलो हाँ हाँ हाँ
आरुष को ना डैंड्रफ बहुत होता है ड्यूरिंग विंटर स्पेशली, तो उसका मुझे पूछना था।
Again, like I already mentioned, dandruff it might be presenting as scaling on the scalp. You might feel it as dandruff, but it could be something else. So once you share the pictures, I can guide you better. Because I don't want to just hear the complaints and give a wrong guidance.
Exactly. Exactly. Parents would request, like ma'am is repeatedly saying, you can send the pictures to her and ask your question there. Vivan is raising hand. Vivan Agarwal.
Yes.
Yeah.
विवान अग्रवाल, इसके हेयर्स बहुत पतले हैं, मतलब जैसे स्कैल्प में कहीं कहीं तो है और कहीं कहीं बाल ही नहीं है। आई विल शेयर पिक्चर ऑफ इट।
कैन यू शो इट?
आप पिक्चर लेके भेजिए, तब तक हम दूसरे अपने दोस्त से बात कर लेते हैं। नाहिद खान कह रहे हैं, हेलो आई एम इन भोपाल एंड थैंक यू फॉर वेरी इंफॉर्मेटिव सेशन। थैंक यू नाहिद जी, बहुत बहुत शुक्रिया हमारी डॉक्टर दोस्त का, सहाना जी का, जो इतने अच्छे से हम सबकी क्वेरीज को ले रही हैं। एंड रश्मि जी कह रही हैं, इट इज एडवाइजेबल टू यूज मॉइस्चराइजर इन समर्स टू।
Yes, this was what I was mentioning earlier. Summers doesn't mean that even if it's humid conditions, it doesn't mean that you don't need to use moisturizers. It's definitely a must because your skin also gets dehydrated. But even I've been having experience in various parts of the country, like I said, because my husband is in the army, we keep shifting every 3 years. If it is in back, maybe I would not have recommended, but I've seen that summers in many parts of the country can be dry as well as humid, but in both conditions, moisturizers are must. Whatever moisture you give to the skin, that's what its main food is. That's what keeps it healthy, and it can in turn protect you from environmental pathogens.
So we have Vivan there. So Hanji, you can. You are muted.
Okay. वेरी थिन हेयर्स और स्कैल्प में कहीं कहीं तो इसके बाल है नहीं। Is it visible?
How old is the baby?
9 months old.
9 months. Please don't worry. Do you have the custom of tonsuring? Baal dete? I mean, some people do it at 3 months or 11 months or.
After 3 years, we will do that custom.
After 3 years, okay. See, in kids, usually the hair is sparse. There are different types of hair: vellus hair, terminal hair, the lanugo hair, right? At birth, every baby has more soft and light pigmented hair that turns into terminal hairs later. And it's different for each kid. Some babies have very sparse hair at birth. Some have heads full of hair. So don't just compare with other kids and think that your baby has sparse hair. That's a good amount of hair that the baby has. Regarding certain areas, see, that's why I said I want to see rather than hearing complaints. Earlier when you said complaints, it sounded like alopecia areata, which is a very different condition. And this is just a normal, healthy, happy baby. So nothing is wrong with the hair.
Particular shampoo I can use for him?
Any baby shampoo you can use.
Okay. क्योंकि उसकी scalp बहुत dry रहती है.
Dry रहती है. Yeah, you can use shampoo. You can use coconut oil. That's the safest for kids that I recommend.
Okay, for washing.
You can use the oil. Apply the oil after 2 hours. You can wash it off. Right?
Okay. Thank you.
Intake is good enough. If the milk intake and you must have started weaning the baby, right? Something solid.
Yeah. But he did not take, ये ऊपर का दूध नहीं पीता है, breast feeding पे है.
सॉलिड्स दे
बिकॉज
रहे हो
सूट नहीं करता है।
सॉलिड्स दे रहे हो, खाना दे रहे हो?
हाँ, सॉलिड से स्टार्ट कर दिया है उसके।
सॉलिड्स में जस्ट मेक श्योर एज एंड व्हेन यू आर इंट्रोड्यूसिंग थोड़ा वेजिटेबल्स फ्रूट्स भी इंक्लूड करो। तो अपार्ट फ्रॉम दैट नथिंग मेजर हैज टू बी डन एंड डोंट वरी अबाउट द हेयर।
ओके,
एब्सोल्युटली।
बहुत बहुत शुक्रिया डॉक्टर। और दोस्तों अब समय हो रहा है, हमने हालांकि लेट स्टार्ट किया था तो इसीलिए हम आगे भी बढ़ पाए इतना टाइम, एंड ये करीब 6:50 के करीब हो रहे हैं। तो आज का सेशन हमें यही खत्म करना होगा। समीक्षा, एक बार फिर से हम दोनों ही मिलके जो है डॉक्टर सहाना का बहुत बहुत धन्यवाद करते हैं, और जिस तरीके से उन्होंने नंबर भी शेयर कर दिया और आगे भी वो हेल्प करने के लिए तैयार है। मैम, हम आपको बता नहीं सकते सच में ये कितनी ग्रेट हेल्प है, बिकॉज हर एक चीज जाके डॉक्टर को नहीं बताई जा सकती है, और मतलब कई बार नहीं भी हो पाता है। कई बार मतलब आसपास तो हम दिखाई लेते हैं, लेकिन इस तरह एक्सपर्ट से इस तरह की राय मिलना बहुत बड़ी बात है। एंड कुछ और पेरेंट्स ने हमारे साथ पिक्चर शेयर किए हैं।
एग्जैक्टली,
जी जी, हम नहीं शेयर कर पा रहे हैं, लेकिन डॉक्टर सहाना को हमने उनसे बोल दिया कि वो डायरेक्ट कांटेक्ट करें। डॉक्टर सहाना, अभी सीमा से आपकी बात हुई थी जिन्होंने अपनी बेटी के पिक्चर्स ले लिए हैं, वो आपको भेजेंगे।
I'm able to upload them on my system. Shall I share, ma'am, abhi, if you have time?
Yeah, but I'm sorry to interrupt. I just want to take this one query on the chat.
Yeah, ma'am.
Has messaged, my daughter has recently developed patches of dandruff and white patches like psoriasis. If I apply Bestopic ointment, it clears, forms in another place. I would request whoever has sent this note that applying Bestopic ointment, you're actually causing more harm to the child. Without consultation, none of the topical should be used. Maybe it clears initially. If it's a fungal infection, it immediately responds to steroid. But once when you stop the medication, it will rebound double. So kindly don't treat any child based on your limited knowledge. Always have a consultation with a doctor.
So I would share, I just have to see where the pictures are. Can you see my screen?
Ji.
Yeah. Here is the picture of the patch he has sent. 1. This is 2. And this is the prescription.
Okay. Okay, this is a condition we call as Alopecia Areata.
Yeah, right. I can stop share.
Right, you can stop share.
Yeah.
May I know where the child is from?
Seema is from, Seema, you are in Panchkula nowadays? If you are there?
Karnal.
नहीं, मैं करनाल में हूँ, हरियाणा.
Haryana. Okay, the treatment that was shown, the medications that were shown are the drugs used for this treatment. But I would like to tell you this alopecia areata is an autoimmune condition. Like when any person has fever, antibodies of infection, antibodies are formed. That's when the person gets fever. In the same way, autoantibodies are formed against one's hair follicle. This is an autoimmune condition. In many kids, one patch occurs and it's treated and it stops at that. But in many cases, it so happens after treatment, there can be new patches which are formed. So this will take quite some time to resolve. You'll have to find out the thyroid status of your child because they can be related. Thyroid disorders can occur in patients with alopecia areata. You'll need to continue this treatment for some time. Though in adults, we do give intralesional injections. I don't know the age of the child, but if it's possible to get this treatment done.
She's 17. मैम, उसके क्या आईब्रोज के बाल भी जो है वो उड़ चुके हैं, आईब्रो और अपर लिप्स के.
Okay, so ये भी हो सकता है. Alopecia areata is patchy hair loss. Alopecia totalis is when other areas of the body start getting involved, like eyebrows, upper lips. इसमें you will need to have systemic medications, a little stronger drugs that may need to be added. So you can contact, if you have any certified dermatologist at your place, you can contact them, or else we could have a teleconsultation where I could counsel you on the course of the disease and also guide you on what treatments you can use. But best I would say if you can meet any dermatologist in person, because all the medications that are used in this condition are a little strong. They need follow-up frequent tests need to be done. So I think you will be in touch with a skilled dermatologist. Do not do doctor hopping, because if you do that, every doctor treats patients in a different way. They have a different style of treating. So and follow up with them. We'll hope for the best result.
Okay, thank you, ma'am. Thank you.
Thank you, doctor. And we are really exceeding time, but one parent was able to now give me the pictures and I am able to upload. If you don't mind, ma'am, can I take?
Not an issue.
Yeah. Thank you so much. So this is Bhavna. Bhavna, you can unmute yourself by then. These are two pictures she has shared. These two pictures. Bhavna, these are your pictures? I think she should be there to us.
Second picture is not very clear.
This head one.
No, the one with the rashes on the body.
Okay. So I would try to.
थोड़ी सी छाया आई हुई है ना उस पे पैच पे.
Right. Are these itchy?
Bhavna, are you there?
It looks more of a seborrheic condition, because this excess sebum secretion can occur on the body as well as scalp. Though I say that after puberty sebum secretion increases, but in kids the maternal androgens can take. So I think Ms. Bhavna can get in touch with me and let her know what creams and shampoos can be used.
Okay. So Bhavna, whenever you see this portion, you can get in touch with ma'am. And her numbers in the chat box, parents, you can quickly note it down. And anything else, Parul? We had a very informative session today. And it was really nice that parents could ask and they could share in the last minute pictures to us and we could share with ma'am. Thank you so much, Dr. Sahana, for being so patient and giving answers to every parent. Parul.
Thank you to all the participants, and special thanks to Parulji and Samiksha ji. You both look really lovely today.
हम तो आती सेशन में इसलिए है कि हम अच्छा दिख सके.
मेरे को टाइम नहीं मिला रेडी होने का.
बहुत बहुत शुक्रिया डॉक्टर, और बहुत धन्यवाद मेरी दोस्त समीक्षा का कि वो किस तरीके से टाइम को स्ट्रेच कर करके पेरेंट्स की हेल्प करने के लिए किस तरह तैयार रहती है. मुझे बहुत क्यूट लगती है वो ऐसा करती हुई. आई लव यू समीक्षा.
Thank you so much, Parul, and thank you, parents. It was a really nice session today. We could not go live on FB. We are live on YouTube, and later on this session will be posted on Facebook also. You can access, and I hope you have written down ma'am's number. That's why I'm holding on to it, and you can decently send her a message and pictures, and she will patiently reply to you. Thank you, Dr. Sahana, for this.
मैं अब इस सेशन को एंड कर रही हूँ.
Yeah, thank you, Parul. See you all.
Bye.
Bye bye. Thank you.